After conducting hundreds of thousands of COVID tests, the TestNebraska program has been shut down. But that doesn't mean you don't have access to testing resources if you really do need them. NTV's Alex Whitney has been looking into where Nebraskans can still get tested for COVID.
Well, we thought we were out of the woods, but it seems like COVID is making a mess of things again. And with the Delta variant surging across the country, it's important to know where you can get tested if you've been exposed. The TestNebraska program has wrapped up, but that doesn't mean that you can't find testing resources locally. After performing nearly 800,000 COVID tests, TestNebraska has finally closed its doors, coming at a time when COVID cases are beginning to surge again here in Nebraska. With cases up, it's important to know where to get tested, and officials with DHHS say the best way to find a testing location is to reach out to your local officials.
So we recommend them working with their primary care managers. There's a lot of testing through pharmacies and such as well. Also, you can call your local health department, and they might be doing the testing internally, or they have contracts or memorandums of understanding MOUs with other facilities to do testing for them.
Unfortunately, without insurance, your COVID test is likely to come with an out-of-pocket cost. Costs can change depending on your location, but locally, testing costs have ranged anywhere from $50 to $139 between healthcare providers and pharmacies. If the cost is an issue, though, many local health departments can help.
Definitely some of the places do have a cost associated. And again, we do have some access, though, for people who can't afford a test, especially if they're symptomatic, that we can help get them to the closest place for one of those either low-cost or no-cost tests.
Cost isn't the only thing to consider when looking for a test. Many locations will not test you if you have not had a known direct exposure to COVID or are not showing symptoms. This can create difficulty for travelers who may have had potential exposures, but McDougall says that local health departments might be able to help with those problems as well.
I have noticed that especially if people are traveling and want to have a test, then there's less options. But, again, if they check with us, we might be able to find them something that will suit their needs.
So even with the TestNebraska program ending, there are still plenty of resources locally for you to get tested if you've been exposed or are showing symptoms.